over the last few years, the Resuscitation Council, along with other European bodies and UK-based bodies, have been researching and putting a lot of effort into changing how we actually perform first aid, and not just in a first aid training environment, but also in the medical background as well. What they're aiming to do is make sure we can increase success rates. And actually what they've done is they've done a lot of research over the last 5 years since the last update came out, and they've actually put in place the biggest update in the last 15 years. So it's massive changes across board, whether you work in the medical profession or as a first aid training provider. Why are these changes so important for first aiders and workplaces? Well, it's changing how we actually perform CPR, and it also changes when and how we get the help that we need to get on site. What they're aiming to do is they're trying to aim to increase success rates when it comes to actually performing CPR and getting emergency medical help on somebody. So what it'll do is it'll change how we actually train the course in the first place, but also the training and the practical elements for people who are attending the courses, so that when they go back into their workplaces, they can actually perform first aid to the required level and hopefully try and save somebody's life. Okay. So what are GEM doing to get ready for these changes? Well, we've actually started to create some standardisation meetings. So we're going to be speaking to all the first aid trainers about the changes, how it's going to change how we actually deliver the qualifications, when the changes are due to come into place, and also we are going back in the film studio to change our online blended learning video training as well. The units that are affected, predominantly the primary survey and the CPR element, but what we're doing is we're trying to get in as quickly as we can to change the content, so when the changes come into place, possibly January, February time, we're ready to just click a button and everybody's going to get the appropriate training to the level that they need to meet Resuscitation Council guidance. So one question we will get asked a lot is, will people need to retrain, or will the changes be included in the annual refreshers and the updates? So anyone who sits the course, anything up to 6 months prior to the change, will not need to do any changes to their training. They should perform CPR to what they have been trained to do. However, if they have the ability to do an annual refresher, they should do it, and it will update them to the new changes. What they are saying though is there's going to be a grace period of about 12 months for people to change their training. But when people come in to do their training and renew, those changes will take effect. People should only deliver first aid to the level that they have been trained to. So for example, if they are trained on a child to do 30 chest compressions to 2 rescue breaths, and with the new changes coming into place, that is different, they should still do 30 chest compressions to 2 rescue breaths. So one major update we have received is a slight change in the pad positioning. Now people always ask me, why is pad positioning so important? It is important because if you don't put the pads in the right place, the shock's not going to get to the right part of the body. The shock from the defib needs to go through the heart, causing the change to what we call a ventricular fibrillation, or a rhythm that isn't normal for our heart. It stops that, and what it does is then hopefully reboots. Basically like a PC, you turn it off and on again, okay, if something's going wrong with it. So pad positioning is massive. So the pad positioning has changed as of this update, but it's not changed too much, but this will be seen in training going forwards anyway, and that's what we'll be assessing people against. So with these new changes, a lot has changed, particularly with pediatric first aid. Some of the major changes I'll quickly run through, but big ones are the changes to age ranges. So it's no longer just classed as an infant, a child and an adult. We now have infant, child, adolescent and adult. So you'll see that coming forward in the training as well. What we've also got is the changes of when we use certain pads and certain pad positioning on certain age ranges, but again that'll be revealed in the training. We also have the change of going from 30 chest compressions and 2 rescue breaths to 15 and 2 on a child. So there's a major update. And also the changes to how we perform infant CPR. But previously we're using 2 fingers in the center of the chest, and now what they're aiming to do is they're using 2 thumbs. They're using the 2-thumb method. And again, when people are attending the pediatric first aid or their annual refreshers or their updates, that will be explained to them.